I'm Alodia Gabre-Kidan. I'm one of the colorectal surgeons with Johns Hopkins Medicine, and I practice at Howard County General Hospital and at our Bayview location as well. So once we find that a patient had a colonoscopy and they have either a mass that came back as cancer on their biopsies or a polyp that can't be removed, then the first step that we really do is look to make sure that the cancer hasn't spread anywhere else in the body. So the most common place that colon cancer goes to outside of the colon is the liver. So we'll get a CAT scan of the abdomen just to look at the liver specifically and see if there's anything suspicious there. We'll also get a CAT scan of the chest, and that's to look at the lungs because that's the second most common place that it can spread. Provided that those are both clear, and most of the times if you've been staying on top of your colonoscopies, then we can catch this at a pretty early stage. The next step is surgery. If unfortunately we find anything in the liver or the lungs, then the first step is actually usually chemotherapy or some way to treat the disease that's spread outside of the colon. Depending on where the tumor is or where this large polyp is in the colon, then we start talking about the methods to remove it. But the goal really with any colon cancer or cancerous polyp is to remove the section of colon that has the polyp along with the blood supply and the lymph nodes to essentially clear all the tissue that could be harboring cancer.